Diabetes and hypertension. These are two chronic illnesses that are very common. It seems like everyone has it. However, these conditions can be very debilitating. We encountered a 70-year-old lady with both diabetes and hypertension. She was on 2 medications and she was tired every day of her life. She wasn't sure if her illness or symptoms were due to the primary disease or the treatment itself. She came to us for help. Let's see what happened next. So Camille, tell us about this 70-year-old lady with diabetes and hypertension.
She was 72, had a history of those conditions for about 30 years and was on both sartan and amlodipine for her hypertension and maximum dose of metformin, 2,000 milligrams total a day for her type 2 diabetes. But despite being on these medications, her conditions were not controlled. She felt tired. She felt extremely dizzy all the time, and she'd had her blood pressure medications changed a lot, and she was feeling very disheartened and came here looking for another solution, trying something different, the lifestyle intervention.
Wow. You know, it's interesting because the two chronic illnesses, diabetes and hypertension, can cause fatigue. And oftentimes, fatigue and dizziness can be side effects of medications. And I've frequently seen in my career where patients are treated for a health condition with a medication. The medication may make the numbers look better. For instance, it may make the blood pressure numbers lower or the diabetes numbers better. However, the medications can contribute to side effects. In fact, I've seen situations where both the chronic illness and the medication are both contributing to the side effects. In other words, they're fatigued because of the hypertension and diabetes, and they're also fatigued because of the medication being used to treat these conditions. And so it can be a double whammy. Even though the intention is to make the health condition better with the medications tend to make the health condition worse. So it's possible that that's what was going on here. So what did we find on our evaluation of this patient?
So her blood work showed that the bad cholesterol was 120, and we'd want that closer to 70. Her hemoglobin A1C was 7.1, which, according to some, is not bad for diabetes control, but she wanted to reverse her diabetes and get off the medication because, like you were saying earlier, she was wondering, what if this medicine, which can adversely affect my liver or kidneys, is contributing to my fatigue and overall unwell feeling. I ordered a coronary angiogram as well, and that showed some mild plaque buildup in the arteries of the heart, so we really needed to take this seriously and get her started on an intervention quickly.
So again, the amount of coronary disease she had did not qualify her for any surgery or stents. However, she was still at risk for a heart attack. The A1C being as high as it was showed that her diabetes was not controlled and her cholesterol was elevated. So metabolically, she was out of balance, and therefore biochemically and physiologically, she was out of balance. And so we need to address this problem at the cellular level, at the biochemical and metabolic level. So how do we intervene with this patient?
We met with the nutritionist and the culinary team in the kitchen and developed a raw plant-based detox diet. So this consisted of food levels 0 to 4B. We avoided some things that had higher starch or glycemic index due to her diabetes. So we stuck to some of the lower glycemic index fruits, the ones that had a little more fiber content, and more veggies as well than fruits. And we also implemented the infrared sauna therapy. So that was a key contributor to improve her endothelial function or improve how her blood vessels open up, regulate her blood pressure, help her perfusion to her other organs and body systems. And we were able to get off the low sartans, and that really helped her dizziness go away. And then we reduced the metformin because naturally her blood sugars were coming down. So that was a big improvement as well.
This is impressive. Of course, the nutritional intervention has a positive impact on high blood pressure. We've shown that in our medical literature, as well as it has an impact on diabetes. We were able to show that you can reduce hemoglobin A1C significantly in just 4 weeks with a nutritional intervention. We published that in the medical literature. And that's due to the fact that we're reducing the high blood sugar swings. Infrared sauna is anti-inflammatory. It can also have a positive effect on blood pressure control. And the medication weaning, I like to think of as part of the therapy as well. So even though the treatment with the nutrition and the sauna allow for the medication weaning that we do is intentional and actually fairly aggressive. So that's part of the treatment. As of course, the side effects can go away, but the medication can also have adverse effect on the body biochemically in some situations to where it could be worse than the condition. So it's great that we were able to wean the medications as well. So how did this patient do? What was her outcome with this intervention?
Well, she did great. Her A1C just within 4 weeks did go down about 10%, even when we reduced the metformin from 2,000 milligrams down to 500 milligrams. So that was wonderful improvement, and her bad cholesterol went down 20% in that short time frame without medication for high cholesterol. The molecules that bind cholesterol to the arteries also went down because she was changing her diet. And her dizziness was gone. Her energy level was great. She enjoyed exercising now, whereas before she was too dizzy and too tired to do that.
So she had an overall improved quality of life along with disease reversal. I always like to emphasize the standard treatment for illnesses. Frequently, not only do they not improve quality of life, but in her situation, they were probably adding to the worsening of her quality of life and weren't controlling things. So despite the medication she was on our initial evaluation, her diabetes was not controlled, her cholesterol was not controlled, her blood pressure was probably not optimized despite the medication. So with this intervention, we were able to remove the medications, and she not only improved, but her biological markers showed that the underlying health illnesses, chronic illnesses, were regressing. The diabetes was regressing. The underlying cause for the hypertension was regressing. So a very powerful impact in just 4 weeks. So this simple and direct approach can be very effective and work very fast, and can turn your life around very quickly as it did in this patient. I'm very impressed. So I hope you got a lot out of this. And as usual, with any questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.